Okay. Okay, so we're fortunate today to have a presentation by Caregivers Alberta. We have Daryl Gregory here. His partner, Jonna Lowther, is unfortunately away, but Daryl, I will pass it over to you shortly. Before that, we will do some resources after. And just a reminder, our January meeting is Tuesday, January 23rd at 9:30. And at that one, we're having a presentation from the Canadian Red Cross Friendly Calls program. But with no further ado, over to you, Daryl.
Thank you, Blair, and to the rest of your team. I'm just going to share my screen now. Yeah, so as Blair said, my colleague, John Lowther, my Director of Programs and Services, usually plays the lead on these presentations, and I support her. So she is away ill today, so you get the understudy. So please, please be nice to me, and I'm going to do my best to get through this presentation. So supporting caregivers in community. Why is that important, and why is Caregivers Alberta important? We know that caregivers are a large part of providing care in community for their care recipient, and they are going to be taking on an increasingly more complex, more diverse role in providing care for their care recipients. And we know that caregivers, family caregivers, are under some duress. They can be under strain, financially, emotionally, physically. And so it's important for us to be able to connect with caregivers throughout the province, let them know that we're here, what programs and services we have to support them so that they can connect with us. So that's why I'm extremely appreciative of the opportunity to speak to your group and just talk a little bit about our organization, about caregiving in general, and some of our programs that we have for support. So why is it important to identify as a caregiver? You know, in a lot of the conversations that we have within with healthcare professionals, you know, we're doing a lot of work to have the caregiver identified, formally identified within the healthcare system, so that, for example, when a patient is discharged from for example, hospital, we are able to identify that caregiver and make sure that the patient is well supported at home and they have the tools and resources that they need to provide care for their care recipient. So we could ask ourselves, you know, some simple questions. Are we supporting someone with an illness? Are we supporting someone with a disability? Someone who's an aging parent? Do we support someone with mental health challenges? And do you drive someone to appointments? Which is me. I'm early on in my caregiving journey. I care for my aunt, and right now that just involves driving her to appointments, picking up her blister packs at the pharmacist, and that sort of thing, and groceries. So it's important that we identify as a caregiver because it not only enables us to identify where we need support, but we're able to say to our care recipients, family doctor, and others in the healthcare field that I am the caregiver, right? So that they know who I am, and then they can connect me with supports as required. So who are caregivers? Generally speaking, caregivers can be parents of children with a disability, adult children taking care of seniors, a spouse taking care of someone with a disease or an illness, or a friend or neighbor taking care of someone who they're not even related to. A little bit more into the demographics of care. Caregiving is pretty much split down the middle in terms of gender, but about 50% male, 50% female. Although I think that when we talk about the acuity of care, that there is research that shows that women are taking on more of those complex care needs at home. About half of caregivers are working full-time, which has its own challenges. And I can talk more a little later in the presentation about a program that we have to support employed caregivers by working with employers and employees. We know that 63% of caregivers are in their prime earning years, which has also has some significant challenges because it can have a severe impact on their ability to maintain income for their family. About 20% of caregivers are under 30, and in fact, some caregivers are quite young and can be caregiving at the age of 5. One of our programs that we have, we're running a pilot program in Calgary starting in January in partnership with the Young Caregiver Association and the Calgary Foundation to support caregivers who are aged 12 to 15. So if you know somebody in Calgary, in the Calgary area, who's 12 to 15 and has a caregiving role in their family dynamic, I'd encourage you to reach out to me after, and we can see if they'd be interested in that pilot program, so that they can connect with peers and we can support them through this program. 17% of caregivers are seniors. That's another program that we have that I'll talk more about later. We have a Caregivers Alberta Seniors Ambassador Program where we can specifically connect with seniors caregivers to provide them support and see if they can help us connect with other caregivers in their community. And I'll talk more about that shortly. So a little more on the demographics of care. We know that most of caregivers are caring for a parent. That's the largest demographic. About 10% are caring for a child. About 12% of caregivers care for a spouse or a partner. 4% care for a sibling. And 16% are that family that friend that I had mentioned earlier, who are providing care to someone who they're not related to, neighbor, or a friend. We know that of the care that takes place in community, about 80% of that care is provided by the family caregiver. I was in a meeting, and I'm sure many people here were in the same meeting, the last meeting of the Alberta Association on Gerontology, and there was a presentation there by somebody from Alberta Health, who talked about, and she mentioned that currently the ratio of community care versus facility care, 51% of care is currently delivered in community versus 49% in facility. And the goal is to have 70% of that care delivered in community. I can't remember what the timeline on that was. I know Sharon Anderson in this meeting, and she probably knows. But that is going to mean that as we drive more care in community, it's going to place more demands on the family caregiver. Hence, we're going to make sure that we have the support available to help them take on that role. There is an economic impact that caregivers have to the Alberta economy. Through our research partner at the University of Alberta, Research on Aging, Policies and Practice, through their research using the General Social Survey Statistics Canada of 2018, they know that caregivers in Alberta contribute about 647 million hours of unpaid care per year, which translates to about $12 billion to the care economy. Care that, if was not done by a family caregiver, would have to be done by a paid healthcare So this slide is one that, when I'm doing presentations to different community groups, this slide is very important to me. When I joined Caregivers Alberta a little over a year ago, I wanted to have some roundtable discussions to meet with caregivers, try and understand the issues, understand how they're feeling, and just get a sense of what day-to-day looks like for a caregiver. And the people who made who I was struck with and made an impact on me, a profound impact, was the people in this little oval there at the right side of this slide. When we talk about, one of the things that I talk about in our organization is we need to try try and gauge where people are at when they first reach out to us. And some people are reaching out to us sort of in a what I call like they're sort of where they are at in a state of overwhelm and fatigue. Some people, it feels like they're at like a 9 out of 10. And we need to connect with folks further upstream in their caregiving journey, because when they get to this right-hand side of this graph, it's, and I'm not a doctor and I don't use this in a medical sense, but it's like a state of trauma. It's like there's no ability to fight. There's no ability to take flight. And so it's almost like a state of freeze. It's like there's not many options for them because they are trapped in the complexity of their role as a caregiver. And so we need to make sure and connect with people in community so that they know who we are and are able to reach out to us. So, for example, we have some peer support groups that take place throughout the week. Does somebody in Fairview or Pincher Creek or Grand Cache, do they know that they can connect with fellow caregivers in one of our peer support groups? They could do that tomorrow if they wanted to. And I'm not sure that everybody knows that, right? So in terms of public education, this is of high priority to me, that we make sure our caregivers throughout the province know who we are and how to connect with us. Care for caregivers. So this is our mission. We empower caregivers and promote their well-being. And I want to give an overview about how we, in fact, do support caregivers when they reach out to us. So caregivers would first contact us through our support line by phone or email. They would get connected with our support intake worker, Munit, who would then have a conversation, sort of triage their needs, do an assessment, perhaps connect them with local resources. At that point, it may be determined that a caregiver could benefit from time with a caregiver coach. So we have caregiver coaches throughout the province who work virtually, and time can be scheduled with a coach through phone or a Zoom session. We have a number of education sessions, lunch and learns on various topics. A little while ago, we had somebody from AHS who was an expert in transitioning from home to the continuing care system. There are a lot of questions around that, and that was a really, really impactful session for people who attended that session. Our caregiver support community, those are our peer support groups, and there are a number of them. One of our most profound programs, Compass for the Caregiver, and I've had so many people tell me the impact that this program made on their lives. That is a 4-week, 4-module program. And I'm excited to say that that Compass just recently, earlier this month, has been made available online through a self-paced module. And if you're interested in that, you can reach out to me after, and I can connect you to that. So a caregiver, no matter where you are in the province, can take that self-paced online version of Compass anytime you want to. We I'm also very excited that we recently added to our support and coaching team by adding a system navigator. So that position started a few months ago and underwent a couple months of training and is now able to provide support in terms of system navigation for caregivers. So this is just a quick overview of what Compass for the Caregiver looks like. And I'm not going to get into this. Jonna would typically know more about this than I would, but the four modules are being a caregiver, managing your stress, balancing relationships, and navigating the system. These are our caregiver support communities, our peer support communities that, as I mentioned, anybody could join these at any time. There are different options throughout the week, different times of the day. There's one specifically for men called Men's Den. So yeah, lots of opportunities for people to connect and meet with peers. Our caregiving coaching program that I mentioned, it's free caregiver coaching, one-on-one support. Many of our coaches have social work and psychology backgrounds and can help people access resources and navigate resources in the community. And so you see the contact information on the bottom there, the support email address. When you use that, it connects you directly with our intake process. So we do a lot of partnership, a lot of collaboration, it, creating MOUs with various organizations, with other nonprofits in community to try and create, well, one, awareness, but also develop formal referral pathways from other nonprofit organizations, such as, for example, the MS Society or the Alzheimer's Society, so that they can connect their caregivers to us for support. But I want to talk a little bit about two of our programs now, the Ambassador Program and our Work and Care program. So just a little bit of history. Before joining Caregivers Alberta, I was at the MS Society of Canada for 15 years, now MS Canada. And I joined the MS Canada in 2005, and we started talking about an ambassador program. And at the time, we didn't really know much about it. It seemed kind of woolly, and we weren't sure how it aligned to our strategic goals and what was it going to do, but we knew that it would help leverage our capacity and community. So we secured about $250,000 in funding, and we created an MS Ambassador program. And it significantly scaled our outreach in community. And as a matter of fact, it was so successful that it was modeled right across the country throughout every division of the MS Society of Canada. So when I joined Caregivers Alberta, I knew that one of the things that was important to me, that we need to increase our capacity, and we can do that by creating an ambassador program. And so we received some funding from Alberta Seniors, Community and Social Services. We hired a volunteer coordinator to create this, start building this program for us. And so now it's a seniors ambassador program to help us connect with seniors 65 plus throughout the province, and to train ambassadors to help us get those connections in community. So, so we can do more sessions like this. We can do presentations in facilities, in residences where seniors are, in libraries, in primary care networks, what have you. So that is the goal of the ambassador program. Oh, I see I have a blank slide here. Oh, no, there we go. Just going to highlight some of the things that that ambassadors can do. So one of the main things that ambassadors can do is share stories. We know that caregiver ambassadors have a story, and I also need to emphasize that we train ambassadors in all of the areas that we want them that they can work in, and it's an alignment between what we need and what ambassadors are interested in, right? So if you're not interested in government relations or connecting with your MLA, you're not going to do that work, right? But you have a story to tell, and we can train you to network. We can train you to share your story, and we can train you to be in your community and do some outreach and that sort of thing. So that's essentially the ambassador program, and how ambassadors can help us expand our leverage and our capacity throughout the province. We know that there are many caregivers in the province who are working full time, and we need to create education and processes to support our employed caregivers. We can do this by working with employees to help build programs, help build flexible work arrangements to support their employed caregivers. So this is a new program for us. We're currently building the modules, and we are ready to pilot this program. As a matter of fact, we were invited to do a presentation in last November, to the city of Brooks. They wanted us to present the working care to all of their staff. Unfortunately, that got pushed back to the new year. We were also invited to share the presentation with RBC in Calgary through their internal resource group. But that got pushed back to the new year as well. So it's kind of a best of times, worst of times scenario for working care right now. We have some good opportunities, but they're going to happen early in the new year. So I just want to share a few stats here that came out of our, as I mentioned earlier, our research partner at the University of Alberta, Research on Aging Policies and Practice, that just demonstrates why it's important to support our employed caregivers. We know that about just over half, about 51% of employed caregivers miss days of paid work because of their caregiving. We know that 14% of caregivers, 1 in 7, reduce paid work hours because of their caregiving, which results in reduced income. And we know that about 1 in 20, 5% of caregivers exit the paid labor force altogether. And, we've seen where someone who is extremely stressed and unable to manage their responsibilities as a caregiver and an employee, and will leave the workforce, and then we'll reach out to say, okay, well, what income supports are available to me now? And the sad truth is there aren't any. And they unfortunately never realized that before they made that decision. And so we need to work with employers to help create caregiver-friendly workplaces. So we want to, through our pilot, we can go in and we can meet with the employer, do a workplace audit so that they know where they are regarding their employees and how many of them are caregivers and what their needs are, because many employers don't even know that. And so that is that is a new program of ours. And if you're interested in a pilot in your community, in your organization, I'd welcome that opportunity if you could reach out to me. And this is just a slide that one of our promotional slides that we share with partners who might be interested in it. Andrew leads the Working Care Project. He was formerly with the Research on Aging Policies and Practice. This is a PhD candidate, and he's doing a lot of good work in this area for us. So what can you do for caregivers? As I said, the main thing that we can all do for caregivers is to recognize who our caregivers are in our community. We have a group that meets regularly. It's our Caregiver Focused Coalition. One of the people in that group is Dr. Richard Lewanchuk. And, I really liked one of the things that he said, um, caregiving doesn't have to exist at the institution level or the system level. We can just be asking people, how are you doing? We can be looking out for our neighbors who are caregiving. We can be shoveling their snow, getting their groceries, but it keeps you, we have to keep an ear to the ground in terms of what is going on in our community and who our caregivers are. And so, I think there's the formal process of creating referral pathways, which we need to do, but we also just need to recognize caregivers in our community. One of the things that we're very interested in, and this has come up in our Caregiver Focus Coalition, um, Dr. Michelle Grinman from Calgary mentioned this, that, we do a good job of mapping the patient journey. We can do a lot more work in mapping the caregiver journey, right? So if we can know where caregivers intersect with various points in the healthcare system, where they intersect with different opportunities for community support, we can then provide education around those areas, and look for opportunities to provide support in community. So that's something that is very, very interesting to me, mapping the caregiver journey. And, I'm trying to see and how I can figure out how to make this happen. Because Dr. Grinman said, if we can combine the knowledge and the data that we have through patient mapping with caregiver mapping, we can really have some robust data to work with. Here's just a quote from one of our clients. And this is my last slide. Just our contact information, how to reach out. And yeah, that is the end of my presentation.
Thank you so much, Daryl. Incredible information. I do see a question in the chat. So Sandy had asked, is there a plan in the future to host another Compass for the caregiver to become a trainer facilitator?
Oh, yeah, absolutely. And this again would be maybe you can connect with me, but this would be a question for Jonna, and there will definitely be. So in terms of training facilitators, we are training volunteer facilitators to lead peer support groups throughout the province. So we right now our programs are virtual. We want to have in community, in person peer support groups with trained facilitators. But also, yes, in terms of Compass, there will be more opportunities to train Compass facilitators. That's a need of ours all the time.
Are there any costs involved to your programs?
Really, the only cost is Compass for the caregiver. And having said that, we never want cost to be a barrier. It's $55, but we never want it to be a barrier. If it is, reach out to us, because we can forgo that cost for people who don't have the financial means. But yeah, that is the only program that has a cost attached to it.
Okay.
There's no for work and care. There's no cost to that. It is an imperative of ours to support employed caregivers and caregivers in general. So we try and ensure that there is no financial barrier to receiving support.
Great, thank you. Any other questions, any comments? There's been a lot of support or recognition of different studies that are done that are in the chat with some links. We might be able to share those when we send out the presentation or the recording, so we can share some. I know Cindy had shared some, but any other questions or comments? Anything anyone would like to ask or share?
Oh, I will. Sorry, I just got a note from one of my colleagues.
Yeah.
And I know Sharon, you'll find this interesting because it came up in the Alberta Association on Gerontology when we were talking about our conference. And we were trying to avoid October if we could. And we mostly avoided October. It's right at the end. It's that last weekend in October and November 1st. So it's like October 31, November to November 2. And I am so excited for this because it's going to be an in-person event with we're thinking 2 satellite locations, possibly Lethbridge and Fort McMurray. We had our first conference in 2022, and which was 100% virtual. So yeah, we are all very excited the fact to actually get together in person in Edmonton, November 2024.
Well, that'll be exciting. Sharon, I see you have your hand up.
Oh, I'm so looking forward. The conference that Caregivers Alberta had a year ago was absolutely fabulous. Fabulous speakers. It was really great, and lots of attendees. And I'm sure that this one will be even better as hybrid. What Daryl is talking about is the Canadian Association on Gerontology is here in Edmonton in October, as is there's going to be the North American Integrated Care Conference, which is this group is really working on that integrated care. That's going to be in Calgary in October too. So that's a really good thing. The other thing related to what you said last, she was talking about training high school students, and what came up at the Alberta Association on Gerontology, that same meeting that Daryl and I were at, was also that the Alberta government is actually looking to train healthcare aides, so as part of their high school program. So starting in grade 10, and by the end of it, grade 12, they will probably have their healthcare aid certification. Now, there's 3 school boards in central Alberta that are doing that. But if somebody is interested in that, they should actually look at it or ask more about it and see if their school board and if there's funding available. But that, so because that support from healthcare aides, trained healthcare aides for respite in the community is going to be a significant issue as time goes on.
Yeah, very much.
Sharon, I was just going to ask if you wanted to just talk a little bit about your comment around everybody being able to come together for more of a collective impact idea around caregivers, maybe just to share your thoughts on that.
Yeah, Daryl talks about pathways and those referral pathways, and healthcare providers need Caregivers Alberta and the Alzheimer's Association, the MS Society. Those are all real. Everything is really important, but healthcare and what community organizations also do is really important. So, for example, Grand Prairie. I'm going to talk about Grand Prairie because they're just an example of what you can do in community. I was they provide home services, like the home support services, across the entire county. Where does that happen in rural Alberta? They have a navigation system set up so that they can learn and learn where people are going to, what services they're asking for. So the question is how do we have those warm handoffs between healthcare and community organizations, and that we know if there's not enough transportation in the community. So what we need is that collective impact approach, and who is doing what. There needs to be government policy. There absolutely needs to be community services. And yes, healthcare providers need to have a role. They need to be trained, and we need to have those policies about, I'm sorry, but we need to have caregivers identified in Connect Care and in family doctors' records. If we don't know who has a caregiver and who doesn't, how do we know what the unmet needs are? Or how do we know, I expect that caregivers are likely creating much better outcomes for people. There may well be fewer hospitalizations or less use of the hospital or of the healthcare service, but we need to know those things. And unless you have data, you don't know those things. So there's lots of things that we need to do. We need a caregiver strategy and those integrated health and community services.
So a call out to our government partners there about helping to bring that together. Thank you, Sharon.
I see Cindy had a question. Are you open to training facilitators like Team CarePal to share your work in care program?
Oh, yeah, absolutely. I think that's we're talking about integration, right? And so 100%, yeah, that's a solid yes.
Great. Any other comments or questions anyone would like?
I was just going to bring one forward from community we had a meeting with last week, and they were talking about that transition for people when they're living in the community and then are ending up going to some type of a facility setting, and just wondering, are there some of your programs that target that group, or what have you found really helpful for that group of people?
Yeah, that is a big question. And it's, yeah, I don't think we have enough, Helen. Yeah, it is something that we were just talking about this in our my operations meeting last week. We need to provide more education on this, because there's, as I have the opportunity to sit in some of our peer support meetings, there's a lot of confusion. There's a lack of understanding. And so my only answer to that is to say I'm working on it. And I'm having conversations with Jonna and the rest of my team to pull this education together, because it needs to happen. Because yeah, people have a lot of questions, and yeah, a lot of confusion. So yeah, that's all I can say about that.
Kind of a high priority area that
It is a
you're
high
starting to
priority
look at it.
area.
Yeah,
It is,
yeah.
right? When we meet to talk about our education planning, that's at the top of the list.
Thank you.
Great. Oh, Trine has a question. So how do you convince people to get connected to Caregivers Alberta when they say they're too burned out to access another program? Sometimes it's difficult to get that buy-in for caregivers who feel they cannot add on another program.
Yeah, that's exactly what I was talking about in that slide. It's when this is just human nature. When you are at the end of your day and you've checked off all the essential boxes that need to be checked, do you want to reach out, or do you just want to, have a glass of wine, watch some TV and whatever it is, right? That's the reality for people, right? That's why we need to connect with people earlier, upstream. I guess I would just encourage with the peer support groups that we have, the virtual peers, it doesn't take much effort to just log in and listen. Nobody has to say anything. You can just listen and to fellow caregivers, and yeah, and maybe that's a starting point,
Right.
but you need to start. And as hard as it is, you need to start. And it's just getting the login information, and I can connect with me after this meeting, and and you can just join in and listen.
Yeah, definitely that recognition. I like Sharon's point about it being notified in a client or patient's chart who is their caregiver. So then that's starting a bit proactive. You can reach out, you can then provide that support earlier on rather than waiting sometimes till there's missed appointments. There's that burnout that we often see after long
Yeah,
years
that's
of that.
part of the formal process of a referral pathway, right? Where it's not just left to chance. So that there's a kind of part of the social prescribing model, right? I think it's formal, it's a loop, so you ensure that that the caregiver somebody is making contact with them, and you can report back, right?
Yeah.
It's not just a loosey-goosey sort of referral, right? Well, here's a name, connect with them. You have to close the loop, right?
I think it's interesting. I'm thinking back to our presentation last month from Sharon and Jasneet and the caregiver-centered care education, because I think part of that is, and I think about cancer care, because often with cancer care, you get the diagnosis and then you're referred and the caregiver is referred for support. And so how do we get that more widespread? And the education, of course, should help with that. But I can really see that being essential, so that it's not waiting for the caregiver to reach out. It is like, oh, here's where you go, start to get this information, at least you know the resources, right?
Yeah. So just on that, you're like, we have this beautiful referral package here. Oh, sorry. Blurred. You can't see it, but it's a beautiful referral package, right? We just updated it. They're all brand new. So you can't just give that to someone. Oh, here, because again, is anybody going to do anything with that? It's another thing to look at. If anybody wants to get their hands on one of our referral packages and see all of the different things that are available, reach out to me. I can have that sent to you.
Great. Sharon, did you have something to add there? I just see you're off mute there.
Yes, absolutely. Those, I was just popping it in the thing. Dr. Elizabeth France, who does our partnering module in the Advanced Caregiver-Centered Care, is a geriatric psychiatrist, and she talks about her biggest wish is to have caregivers referred to supports earlier. So, you know, Caregivers Alberta, the first link, you know, the cancer caregivers are often referred to, you know, they're referred off earlier so that there's actually support for both the person and the caregiver at the same time. But Elizabeth Drance in particular thinks that, you know, that support earlier, and some of that mindfulness, you know, self-care, all of those other things would make it so that caregivers didn't end up so distressed you know, later on, and they would know how to ask for things better as well.
Mm-hmm.
So yeah, support earlier.
Kind of that reaching in model, right?
Mm-hmm.
Yeah.
Mm.
Thank you.
Just see, Glenda, your comment about that is a plan is to have the caregiving or caregiver addition within Connect Care. So that would be definitely, agree, a positive step for that integration piece. Any
Absolutely.
other questions or anything?
As far as I'm concerned, identified caregivers in Connect Care and on those pathways should be a no-brainer. Like if you're expecting them to do 90% of the work and you know, you're, as Michelle Grinman says, care for the person when they get home. You know, there should be policy that says you identify as there is in the US, you identify the caregiver, ask them what they need, make sure that they're aware of the discharge date or transition date, and that they're equipped with the skills when they get home. I think Glenda can probably tell you about somebody who is, you know, who's being discharged home with a PICC line. You know, 50% of caregivers are now doing complex medical care services at home. You know, and you know, we in our double duty caregiver study, they talked, the healthcare providers talked about, well, I'm not sure that I should do this because I'm not equipped to do that at work. I'm not qualified to do that work, but they're asking me to do that at home. Now, what about the person who is not a medical provider who's asked to care for a PICC line?
Mm-hmm.
Yeah, good point, Sharon.
Yeah, that's an important point, Sharon, in terms of like, the and, right? Like it's identifying the caregiver and ensuring they're equipped to handle their caregiving duties, right? That came out in spades when we were at the summit in Ottawa. Yeah, it's identification and ensuring they have the tools and resources they need.
Great.
Just see a comment. Yeah, I just see a comment in the chat there from Tatiana around that the Edmonton Social Prescription Forum has a line for caregiver information. So when they get a new referral, they get in touch with the caregiver too. Great.
Oh, excellent.
So Tatiana, and thank you, Tatiana, because we had a great chat at the Edmonton Seniors Coordinating Council gathering. And what happens is when you're looking at patient and caregiver, you really need to assess caregivers' needs, the patient's needs and their needs together, not just, not just one or the other. And so one of the social, there actually are there's the care support needs assessment tool, and there's also something called the SNAP, the support needs assessment tool for patients. And Ewing and Rand were here in 2019 to train people, including Jonna was there from Caregivers Alberta. And Caregivers Alberta does the CISNAT for caregivers. But what one of the social workers that's using both in Red Deer told us is that she had a patient who was just diagnosed with Parkinson's, and his wife, and when they did the CISNAT and the SNAP, and they were talking about it, well, the patient expected his wife to stay home and care for him, and she was not going to do that. And so, she said it was so much better to head off that family dissension and get things sorted out ahead of time. She said it was that early warning that, what do we do now? So, identification, assessment of family caregivers' needs from their perspective, and then helping them to get to the services they need. And absolutely, Tatjana's really right. The social prescribing program is excellent as well, and Caregivers Alberta is also participating in that social prescribing program. So yes.
Great, thank you.
Other comments, questions?
Great discussion, like always. Yeah.
Yeah, and phenomenal programs offered, Daryl, by Caregivers so Alberta.
Yeah, thank you.
Yep.
Yeah.
So I just want to say that Caregivers Alberta was originally started by Dr. Miriam Stewart, who I worked for. She did a program where she looked at caregivers' needs, and those caregivers, many of them healthcare providers, were the original ones that started Caregivers Alberta. And Dr. Stewart passed away in September, or not in September, in July. She ran the social support research program at the University of Alberta for a long time, so Caregivers Alberta is really lucky to have Caregivers Alberta and the resources that they've got, because Saskatchewan and Manitoba don't have those programs.
Yeah. We are having conversations with Saskatchewan and Manitoba. They're starting to do some work in the area.
Rosalind Compton and JB Petter.
Yeah. but Blair, you're right. We just need to make sure that everybody should know who we are. And yeah.
Okay. We'll maybe bring back, if nothing else, and if there are questions after, feel free to reach out to ourselves or Daryl if you were able to get his information. Like I said, we will be able to share that contact info with the recording. We'll just share a few resources that we have. Okay. So we wanted to pass on 2 webinars that both around food insecurity. So one is navigating household food insecurity in primary care. It's a nutrition guideline. And then there's another about strengthening foundations for patients facing household food insecurity, and that's experience of a primary care clinic. So some work being done then are there. Perhaps in the future, in 2024, we'll be able to have a presentation on the food insecurity, but you'll have those links. You can watch those webinars if of interest. And then just a reminder of our website. There's a QR code, our email address to contact the Connecting People team. On there we do have 2 new, I believe, 2 new pieces of information. We have our lessons learned document is on the website, as well as our SROI. So that social return on investment is also now up on the website. Also, you can find us on Core Alberta. If you're not already, you can join the Healthy Aging. And there's a sign up, and then you can join specifically the Connecting People group. And there is all of the team's contact information. So like I mentioned, feel free to reach out to any one of us if you have questions, anything, and we will be sharing the recording. Can't lie, I'm not sure if that's what Kate does when she's back, so it might be in the new year. But yeah, she's our go-to tech expert, so that is what she'll be doing. But yeah, any last words, comments, Daryl, or anyone else on the call? And we have about 6 minutes left, and it's a busy week as everyone wraps up before the holidays.
Well, the only thing that I might add is, the holidays can be stressful, and it's stressful for caregivers too, right? So maybe just keep that in our back pocket and reach in, as Helen said. I've never heard that before, but I like it a lot. And keep your ears to the ground for what's going on in your community and with caregivers, with your neighbors.
Great, thank you. Well, we'll stay on for a few more moments if there are anything, but if people have to jump off, well, thank you for making the time in your day to attend. And thank you so much, Daryl, for the presentation. You did well. We don't know what might have been missed with Jana, but it was all phenomenal information to share. So thank you so much.
Yeah. And thank you as well, Blair and team.
I just was going to say thank you as always. These meetings are hugely valuable, and just love the format of having the presentation, which always sheds light on what we didn't know was even available. I knew parts of what Caregivers Alberta offered, but as always, thanks so much to the team for making these happen.
Thanks, Jen. Thank you. Okay, well, take care, everyone. Have a good rest of your day.
Thanks. Bye, everyone.
Bye.
Bye.